Nope. Smile on your face lets me know. Okay, I won't compete with Rex there. Iboan and Varnakam. I'll just wait for this tables to come off first. I'm going to riff off while they're taking it off. How's everyone feeling? Good? Recovered from your spice-related gastritis yet? No? Neither have I. It's been an amazing, beautiful conference here in Sri Lanka. I'm sure you've enjoyed the food, the sea breeze, and I'm hoping that you're all feeling nice and relaxed right now, because we're going straight back into the emergency department. It is Monday night, 10:30 p.m. The department is heaving. The waiting room is out the door. The ambulance trolleys are ramped as far as your eye can see. And someone just asked you for the fourth time if there are any beds upstairs. While all this is happening, the pre-notification comes in. 40-year-old gentleman, severe anterior STEMI. They've already lost output twice. They've managed to get ROSC after a couple of shocks. They wheel him in, and you walk with the patient to the resus bay. You can hear the labored breathing of the paramedics as they attempt to give handover. Your previously calm emergency nurse is now scrambling for the pads. The hands are shaking as they're trying to get unstuck the cannulation trolley. You look at a patient, they're scared too. They're gray, they're diaphoretic, and then they're quiet. You look up at the screen, VF. The nurses turn to look at you. Your heart rate goes up to 140 beats per minute. And you do what it is you do when you're scared. You freeze. Just for a few seconds, but you freeze. Suddenly it becomes loud again. Someone start CPR, please. Charging. All clear. Someone please call cardiology. Can someone please put another line in? You try and kick in and lead the team, but sometimes it feels like no one's in charge. A fellow consultant comes in next to you, and your breath settles. You try and remember the 4H and 4Ts. But despite your best effort, the patient dies. Now comes the part that we don't really get trained for. You walk with the nurse in charge to the relatives' room. The wife is there, fearful, looking at you. There are two kids there as well. One of them is probably about 8 years old. Oh God, she's your daughter's age. You break the bad news. The wife starts screaming, and you stand there and hold it all in. Her grief, the children's confusion, and that niggling thought in the back of your head that you forgot oh my God, you forgot to give amiodarone. You're racked with guilt. And as you're trying to process this, there's a knock on the door. Sorry, doc, bed 12 is desaturating. And so you wipe your face. You allow a bit of sigh. And you go out back to your shift, leaving your nurse in charge with the family. You get home. You get home, but your body is still in resus. You're still wired. You head straight to the pantry and try to eat your feelings. Your partner comes up behind you. They're still awake for some reason. They come up behind you and they remind you that it's your turn to cook tomorrow night and look after the child because they've got a late work meeting. You've got your back to them and you just stand there in stony silence. Your partner repeats themselves because it doesn't sound like you heard them the first time. Maybe you snap at them. If only they knew the kind of day you've had, or how important your work is, or how you feel like a fraud or a failure because you couldn't save that man. My name is Heng, and I'm telling you my name so that you know who to curse for bringing you out of beautiful Waligama into the research bay. I am an emergency physician from Melbourne, and I'm the deputy director of our department, working with Dan as a fearless leader, and I think half of our department is here. And yes, this is a selfie I took of me at Waligama Bay yesterday. Now, one of the things I love to do as a doctor is to actually go up to my patients and introduce myself as a fellow sufferer. You've got shoulder pain? I've got shoulder pain. Where's your shoulder pain? All right, and I'll go like, oh, right here, right? And then I'll give them a massage or something. Heng's elbow is a thing at the Northern. What I love to do then is to tell them what has worked for me. And the other thing I'm known as well at my workplace is as the Zen master. I'm essentially the human diazepam. And while people think of me as the Zen master at work, my Zen looks a lot more like this. You know, I'm the duck that's looking calm on the outside, but furiously paddling underneath. I think I do have high-functioning anxiety, and perhaps some of us here as well. So this talk is for you. It's to actually try and examine deeper what it is that we feel at work and what we can do about it as a fellow sufferer. Now, it was FACEM Wellness Week. Was it 1 week or 2 weeks ago? And you know what happens during Wellness Week? The relaxation room comes up. We encourage people to do exercise or yoga. We thank our staff. But as human beings, we are great lie detectors. Those things do not seem authentic or complete. We don't want the faint praise. Asking us to care for ourselves seems like another thing on our already full plate. And we don't want another pizza party. No, actually, we do want another pizza party because emotional eating. So I believe this, that in order to be healthy and well-being, that we're actually made out of three components: our body, our mind, and our spirit. Now, as doctors, we are great at looking after understanding our bodies and what it needs to heal. We're able to minister to our mind sometimes, but then we're missing an essential component, the spirit. Now, before you think that this is a religious talk, it is. No, actually, the spirit component of it, actually, I want to explore is the emotional aspect of our lives that underlie our thinking. I was really interested in personal growth growing up, and I've listened to the podcasts, I've attended the courses. And what I've always learned is this, that our thoughts become our beliefs. Our beliefs inform our actions, and our actions repeated become our habits. And our habits actually become the life that we're experiencing right now. And I want to propose that there's actually a step before that, and that our thoughts is in response to our emotions and how we feel. Think about our emotions as the little sister, all right? If the little sister is troubled, then the big brother tries and kick in place. But unfortunately for a lot of us, the big brother is actually the little brother. Instead of problem solving, it goes into overthinking, catastrophizing. And because emotions are so important, someone's actually mapped it out on a landscape map. Now, we get really good at reading ECGs, looking at another CT image, doing ultrasound-guided regional anesthesia. But perhaps a lot of us are seeing this for the very first time, where it informs so much of our actions or what we believe about our work and our lives. And also, if we can't recognize it in ourselves, how are we going to recognize it in our patients who come with their pain and their suffering, accompanied by all the emotions with it? Perhaps this is a more recognizable, representation of emotion. I think growing up, our parents doing the best they can, we're not sure how to deal with our emotions either. And I'm sure you've heard some version of this, stop crying, or I'll give you something to cry about. It's fine. No, don't worry about what they think about you. Suck it up, buttercup. Our emotions were often invalidated or met with violence or withdrawal. And so we learned that some emotions were okay, but others weren't. And in order to be safe, we suppress our emotions. I think that the biggest emotion that we feel in ED is actually this guy. Who knows what is this? No one's watched Inside Out? Fear. Fear of getting things wrong. Fear of looking stupid. Fear of our bosses. This fear underlies so much of how we operate. For me personally, my greatest fear was when I was acting director of our emergency department a few years ago. I had no idea what I was doing. And I was just waiting for the phone call from my executive to tell me to pack my things and have me escorted out of the place. For you, perhaps, it was when you were an intern and you made your first medical error, or you were a junior registrar on your first night shift, or maybe you're a senior in charge for the first time, or maybe you're a junior consultant and you feel the weight of the department on yourself. And it's not just for emergency medicine, I'm sure it's true across other specialties. Now, fear that is not defined will come out in other ways, will leak out sideways. As my favorite philosopher, just going on your Star Wars team fear leads to hate. Hate leads to anger. Anger leads to burnout. I'm paraphrasing here. Anger leads to suffering, same thing. Fear in our world looks a bit different. It's going to be like getting upset with the paramedics when they bring in one more patient into your already full emergency department. It's getting upset with the inpatient team for not accepting your referral. It's freezing when you're asked a question. It's typing the perfect notes so that the patients can't get at you. It's perhaps sucking up to your bosses in a way that feels inauthentic to you. Fight, flight, freeze, fawn. All because we did not stop to name that emotion. So I think the most important thing right now is to first develop awareness of it. This is how we deal with fear. Because you cannot treat something without a diagnosis. So the next time you feel uncomfortable in your body, right, the next time you've had a difficult interaction, things hasn't gone the way you want it to, I want you to first be aware that you're not okay. When you are aware that you're not okay, then try and give it a name. Back to the wheel, is it anger that you're feeling, sadness, grief, surprise? When you're able to name it, then we can start the healing process. So, what can we do about fear? Is there a remedy for it? Is it meditation? Perhaps it's exercise. Or maybe it's yoga. Now, don't get me wrong, these things are great, but I feel like they're not sufficient, all right? That which is made from emotions needs to be met with emotions. Okay, I'm going to do something now, and I'm going to need your help on this, okay, if that's okay? Yes, audience participation, I'm sure you didn't anticipate that. Can we all close our eyes for a while now, please? All right, come on, everyone, close your eyes. All right, now we're going to find the fear in our bodies. And I know some of you are thinking like, Heng, what are you talking about? When Veligama, it's relaxing, I've got no fear. All right, open your eyes now. Open your eyes. Now I'm going to pick 5 people at random to come up and join me on stage, starting with, all right, exactly that fear. That fear that you're feeling, that excitement, same thing, that's fine. Now just close your eyes again, and work with me now. That fear, where do you feel it? Okay? Some people feel it in their chest as a tightness. Some people feel it as butterflies in their stomach. Some people feel it in their bladder, like they need to pee. Some people feel it, my daughter feels it in her neck. So wherever you feel that fear, I want you to now bring your right hand, please, and find the fear, okay? So you can either put your right hand on your heart or over where you feel the fear is. You can put your hand on your chest, over your lower abdomen. Just do it with me. I see some of you doing it, and I want to thank you for this, okay? Now, I want you to find love. Love for puppies, kittens, your footy club, your child. No, not that one. The other one, your favorite one. Yes, that's right. That's it. Love. Now bring love to meet fear. And say it with me, okay? It only works if you say it with me. Thank you for trying to keep me safe. I am safe now. I am safe now. Okay, you can open your eyes now. Now, I learned this at therapy, so this is $2,000 worth of value here. I've done it with a few of my patients, and some of them feel the fear melt away. For me, when I had that thing, it blew my mind, and I was like, why didn't you start with this? And the fear really hasn't come back in any, form previously. I want you to know this, that even if you don't do it here, maybe you don't like doing it in a crowd, it's a bit awkward, please, in the quiet of your own room, practice it. Show yourself compassion, because fear cannot survive in the presence of compassion. Compassion for ourselves, compassion for the part of us that's feeling scared. Once we meet that with love, then our compassion can overflow to our teammates and our colleagues. So let's go back to that research scenario. You've brought the wife and the kids into the cubicle to say goodbye to Dad. And you've got to conduct a hot debrief. You excuse yourself to the toilet for a minute, and you calm yourself down first. Maybe you even do the exercise. And then you come out to your team, and you thank them for the difficult and important work that we do. And you remind them that they were a good, trained team that was trying to stand between this gentleman and death. And that he was really sick and died despite your best efforts. The future of emergency medicine, the challenges that will face us will not be primarily clinical. You can Google almost any medical condition or drug dose now, which is great. AI will one day help us to diagnose. And who knows what new mAb or antibiotics they'll come up with. But the things that determine whether or not our department will thrive are still deeply human. Our interactions with our colleagues, our trust of inpatient teams, psychological safety, trust and compassion for ourselves, our colleagues, and our patients. Those things will stand the test of time. So I want to end off in beautiful Sri Lanka with a Buddhist concept. I told you it's a religious talk. Karma. Now, when we talk about karma, we often think about cosmic justice, that good deeds will go rewarded, bad deeds will be punished. But what if karma was more like a mirror that life is holding up to you? That the world will interact with you what you believe of it. And if all we have is fear, or we act out of fear, then the world will respond accordingly. So the first step to disrupt that we no longer have to fear fear, is to actually be aware about it. Fear then no longer has to lead to anger or hate. Fear can lead to awareness and compassion compassion for ourselves, compassion for our colleagues, compassion for our patients. And we'll be able to lead them as doctors, parents, partners, and fellow sufferers. Thank you, my fellow sufferers and fellow healers. Obata Subapatam. May your work continue to bring healing and bring joy. Thank you. I'm going to hand over the time now to Simon, who's going to bring us the big picture. Thank you.